Hello everyone, I'm Dr. Mayuri from Nonu Care, and today I'm going to walk you through the process of solving male pattern baldness at Nonu Care. So let's start off by taking a real life case that we recently received at our platform. By the end of this video, we will also show you how successful the treatment was for the client, so do watch it till the end. Meet Vishal, who is in his late 20s. This was the condition of his scalp when he reached out to us about 5 months ago. In this case, we can clearly see that the hairline has started to recede from the front two corners and there is excessive thinning as well. The baldness is gradually increasing from the center of the scalp, also known as the crown area. Now, this is a classic case of male pattern baldness or androgenetic alopecia, which happens to be the most common cause of hair loss in men across the globe. In fact, according to American Hair Loss Association, 90% of men's hair loss is due to some degree of male pattern baldness. Surprisingly, most men suffering from the hair loss aren't even aware of this fact. A lot of Indians tend to attribute such hair loss to external factors such as water, stress, pollution, diet, travel and whatnot. But from a purely scientific point of view, the root cause of the baldness is genetics and hormonal imbalance. Many people fail to stop their baldness due to lack of access to the right medical information. We must also understand that baldness does not appear overnight. It's a progressive condition that can be divided into 7 distinct stages using Norwood scale. Currently, Vishal appears to be in between stages 3 and 4 of hair loss if we refer to this Norwood scale. Now, immediate medical assistance is required to stop the progression, and if he does not start the right treatment now, his hair loss will keep progressing until he loses all of his hair, mostly from the crown region. Now, if we look at his scalp, the follicles are active but they are weaker. This clearly reflects the quality of his hair that has begun to thin. Now remember, weaker the follicles, thinner the hair. Soon the bald spot will begin to develop and grow bigger as the hair density worsens. So how do we stop this? First thing we do here is understand the patient's medical history and rule out the possibility of hair loss due to some other medical reasons such as thyroid or telogen effluvium. We also want to know whether the patient has any problems with his heart, liver or kidney, whether he is already on any medication for some other health issues before prescribing him any new medication. After a thorough assessment of the case, it's time to offer a treatment roadmap. Now, what are we trying to achieve here? For any doctor, the most important goal is to stop the progression of any medical condition, which is preventing things from getting worse. In this case, I'd want the patient's existing follicles to get stronger. Even the weak and dying hair follicles can be saved. The best way to stimulate or reactivate them is to prescribe topical 5% minoxidil solution. Now, although the drug will promote significant new hair growth, it will not completely solve the root cause of male pattern baldness, which is the DHT hormone. For this, we need to use a blocker therapy. So for all the cases that are not in the initial stages, we generally prescribe 1 milligram of oral finasteride tablet daily for 3 to 4 months, but only after a careful medical evaluation. Finasteride is regarded as the most effective DHT blocker as it directly helps in stopping the hair loss by regulating the activity of DHT levels in the scalp, which is the root cause of male pattern baldness. In extensive medical research, the combination of these two drugs has shown to offer best results in the treatment of male pattern baldness across the world. Let's now see the results of Vishal after trusting a scientific treatment and by following the prescribed roadmap for 4 months. The results here are quite impressive. As we can see, the thinning has reversed, there is good amount of regrowth and the hair loss has completely stabilized. Vishal and I are quite happy with the outcome. So what's next? The next step here is to obviously maintain these results. As I touched earlier, the underlying cause of male pattern baldness are genes and hormones. Since genetics are involved, the hair loss cannot be cured permanently. This is true for any genetic disorder such as blood pressure or sugar. So my next goal is to help Vishal switch to a maintenance dose, where we dramatically reduce the dosage of both the medicines. In the vast majority of the cases, the users are able to maintain their amazing results by using finasteride 2 or 3 times per week and 0.5 to 1 ml of minoxidil solution daily. That's a very nominal drug consumption, and it is also why out of our 60,000 clients, less than 0.07 have experienced any discomfort with the medicines. Nonu Care offers the most cost-effective solution to retain your hair naturally without needing any kind of surgical procedures such as PRP or hair transplants. We'll delve deeper into the treatment diagnosis using different real-life cases in our upcoming videos. Always follow up with a qualified doctor before using any medications for hair loss. You may share your queries in the comments and we'll be happy to address them. Hope you found this video useful.